You are welcome to my channel. Thanks for visiting. Remembering to subscribe, sharing all my presentations, and listening to this very one. Today, the topic will be metronidazole. Metronidazole is a medication, right? Are you familiar with that? No problem. Let's go. Metronidazole belongs to the class of medications known as antibiotics, specifically a nitroimidazole. It is an anti-anaerobes, also antiprotozoal, and some classify it as miscellaneous. It could come under different brand names depending on the one available in your jurisdiction, but the most popular one is Flagyl. But it might be Apple metronidazole, Novonidazole, PMS metronidazole, Flagyl, protein, or Metrolag. Uses of metronidazole. In tetanus, metronidazole is better than penicillin. In the past, people will use penicillin. Now we've gotten the understanding that penicillin was the drug of choice for tetanus in the past, but it can worsen the situation for the affected person, meaning penicillin can actually worsen the situation. Whether penicillin can inhibit the type A receptor for Gamma-amino-n-butyric acid. And what would that lead to? The tetanic effects from tetanus toxin would then increase. So penicillin can actually deal with the causative agent, but the effect of the toxin will increase. Okay, in dysentery or liver abscess that is caused by amoeba, metronidazole will be the first drug of choice. Okay, it's already taken care of. Amebic dysentery or liver abscess due to amoeba. In Rosacea, ACNE, bacterial vaginosis, Balantidiasis, bite wound infection, you can use metronidazole. Also, in lower respiratory tract infection like lung abscess. Remember, it is a pretty good drug when it comes to anaerobes, empyema, psoriasis, and pneumonia. In endocarditis, in bacterial septicemia, meningitis, in induced abortion or pregnancy loss, in trichomoniasis. Metronidazole is also pretty useful in handling Clostridioides difficile, that is C. diff. After you must have used clindamycin and other antibiotics, and the patient is down with Clostridioides difficile or Clostridium difficile associated diarrhea, metronidazole per ora will be very useful here. In Crohn's disease, post-surgery, in Crohn's when there is peri-anal fistula, in Dientamoeba fragilis infection, in Giardiasis. Remember, outside it is also an antiprotozoal. In Helicobacter pylori, we use metronidazole. We can see that metronidazole is pretty useful also in brain abscess. Remember, a good anti-anaerobes, right? In intra-abdominal abscess, in pelvic inflammatory disease, periodontitis, aspiration pneumonia, in pouchitis, in skin and soft tissue infection, and surgical prophylaxis. Metronidazole can appear under different forms, like solution for intravenous use. In that case, you can find the generic form at 500 mg in 100 ml, meaning 5 mg per ml. Or, as far as solution for intravenous use is concerned, you can find Flagyl at 5 mg per ml. And you can find metronidazole in form of tablet per ora, and in that case, the brand Flagyl 250 mg and 500 mg will be available. Also, generic form as tablet per oral at 250 and 500 milligrams. Still on different forms, metronidazole could be in form of capsule for per oral use. In that case, could be flagyl, 375 milligram or 500 milligram, or generic, the same dosage, 375 or 500 milligram. Still on various forms that you can find metronidazole, it can be in form of suppositories, like metronidazole suppository given for vagina, one applicator full is metronidazole 500 milligram, and it might be combined with nystatin as 500 milligram metronidazole with 100,000 international unit nystatin. 1 gram applicator every hour of sleep, once a day for 3 to 5 days. Then you can find metronidazole in form of gel, that is topical metronidazole, gel, cream, or lotion under different strengths, like 0.75%, 1%, or 2%. Administration. Metronidazole intravenously should be infused slowly. We don't rush. You can give that in half to full hour, that is 30 minutes to 60 minutes. But we should not use aluminum devices. When we want to give metronidazole per oral, it should be taken with food. Why that? To lower stomach upset or gastrointestinal tract upset. Immediate release forms, either the tablet or capsule, should be taken with food. Let me repeat. Immediate release forms of metronidazole, either in form of tablets or capsules, should be taken with food. The extended release forms of metronidazole, either tablets or capsules, should not be taken immediately with food. So we should give 1 to 2 hours before or after meals. But no chewing, no crushing, and no splitting of extended release tablets or capsules. Mechanism of action. It is capable of inhibiting protein synthesis, and cell death will occur through loss of helical DNA structure and strand breakage after their fusing into the microorganism. Adverse reactions. Central nervous system will pay a price. What could happen there? There may be aseptic meningitis, dysarthria, ataxia, confusion, vertigo, peripheral neuropathy, seizures, optic neuropathy, or encephalopathy. Disulfiram-like reaction. Presentation of metronidazole will be incomplete without this. Metronidazole, when combined with alcohol, will give out a disulfiram-like reaction. And how? Okay, the mechanism is such that metronidazole can block the hepatic aldehyde dehydrogenase. And what will follow? That will be leading to the accumulation of the acetaldehyde in the blood. So, when the alcohol is used with metronidazole, then you run into disulfiram-like reactions. Remember, I've just gone through the mechanism, right? You can pause and rewind. So you'll be feeling uncomfortable or you have unpleasant reactions. So it is meant to discourage, people from taking alcohol. But if you are taking alcohol and you need to use metronidazole, then you will run into trouble. Nausea, vomiting, headache, flushing. And that flushing could be very, very severe. And abdominal cramps. You will experience this when you take alcohol with metronidazole. If you take more metronidazole and you boost the more, then you will run into more trouble of a sudden hypotension, tachycardia, and your liver will be damaged, hepatotoxicity. But it is not only metronidazole that could give this reaction, that sovereign-like reactions. Other medications that could do that will include chloramphenicol. Now, if you go through my presentation on typhoid treatment, I've said a lot about chloramphenicol. You can check my channel for that. Quinacrine could do the same. Prazolidine could do the same. Now, teratogenicity, meaning in pregnancy, be careful. As a matter of fact, should not be given to a woman in first trimester. Why that? Organogenesis in the first trimester. It can lead to cleft lip or cleft palate or both in first trimester. But in second and third trimester, you can risk or take the risk and use single dose in second and third trimester. Other adverse reactions will include nausea, metallic taste. Yeah, I've decided to color this so that you know that many people will be discouraged from taking per oral metronidazole because of this metallic taste. Headache, vaginitis, pruritus, abdominal pain, dysmenorrhea, dizziness, muscle spasm, myalgia, polyuria, dyspnea, and nasal congestion. Flu-like symptoms, chest pain, syncope, tachycardia, flushing, flattening T-wave on EKG, anaphylaxis, EKG in North America, ECG in Europe. Stevens-Johnson syndrome, toxic epidermal necrolysis, vomiting or constipation, anorexia, cystitis, dark urine, or severe hepatotoxicity. Contraindications, meaning when and where we cannot use metronidazole. As great as this medication is not everybody that could use it. In first trimester of pregnancy, I said that a while ago, no metronidazole, I will not give it. Whether it can lead to cleft lip or cleft palate or both in first trimester. You can use a single dose in second and third trimester, said that earlier. Don't give metronidazole with alcohol. If not, you will run into the sovereign-like reaction. Even within 2 weeks of taking metronidazole, if you take alcohol, you may still have the sovereign-like reaction. Don't give metronidazole with propylene glycol products. When there is hypersensitivity to metronidazole, then we'll take metronidazole off the table today. When there is hypersensitivity to nitroimidazole generally, no metronidazole. Also, when there is hypersensitivity to any component of its formulation, we don't give it. Warnings. Metronidazole may be carcinogenic. We're not sure, but just don't give it. Like we've gone through in a while ago that it might lead to cleft lip or cleft palate or both. So don't take the risk. We just won't use it in first trimester. Don't use metronidazole indiscriminately. The side effects might be troublesome than the real problem you are using it for. Review all central nervous system side effects. Peripheral neuropathy is very possible, and that will present with numbness, paresthesia, and neuropathy can even continue after you stop the medication. Still on warnings, prolonged use of metronidazole can lead to superinfection with fungi and bacteria. Remember, if you are using it to attack protozoa, or you are using it to attack anaerobes, remember there are natural flora in any region you are using the medication to attack a particular microbe. But after killing that, then the weaker and lesser agents will start multiplying in large numbers, so giving us fungal infection. Agranulocytosis, leukopenia, neutropenia. So anyone on metronidazole for a long time can then have more and more secondary overwhelming infections from all this. Be careful in patients with bleeding dyscrasias. There is an entity known as Cockayne syndrome. When there is Cockayne syndrome and you use metronidazole, then we will run into a big problem of severe hepatotoxicity and acute hepatic failure. So, we have to think twice. If we must use metronidazole in anyone with Cockayne syndrome, then we should be prepared to face severe hepatotoxicity and acute hepatic failure. So, we must exercise caution in the face of renal failure, liver failure, or central nervous system impairment. Still on warnings, we must be careful when we are administering intravenous metronidazole in anyone that should not be taking sodium. Why that? Intravenous metronidazole contains sodium. Okay? So in conditions where sodium could be retained, we should be careful with intravenous metronidazole because it contains sodium. Therefore, in heart failure, edema, and concomitant steroid use, or anyone on nasogastric tube, be careful with intravenous metronidazole because it contains sodium and it's going to worsen any condition with sodium retaining capability. Note this: food will decrease gastrointestinal tract upsets. Okay? Intravenous metronidazole contains sodium. Just note that. So someone has heart failure or massive edema everywhere, you want to send out the fluid, and then you need an agent to deal with the protozoa or the anaerobe, and you thought of using metronidazole. Remember, in the intravenous metronidazole you want to use will contain sodium. Don't give it now and 3 days after treatment. Don't give it now 3 days before or after taking the treatment. Drug-drug interaction. Because the list is pretty long, so I'll leave that to you and your pharmacist. You may contact your clinical pharmacologist as well. But just a quick recap here that it will be helpful if you give metronidazole immediate release per oral with food. Why that? It will decrease gastrointestinal tract upset. But if you are giving it with extended release, let that be 1 to 2 hours before or after. Between food and metronidazole, create a gap with extended release forms. But immediate release forms, give with food. Also remember, when you are giving the intravenous metronidazole, have it at the back of your mind, you are also giving sodium at that time. So, if the person is having hypernatremia or is retaining sodium, and you don't want sodium to be in excess in this patient, intravenous metronidazole is not the drug of choice at this time. it contains sodium. Okay? Be careful with alcohol now that the patient is on this medication and even days after stopping metronidazole. If not, you run into disulfiram-like reaction. In breastfeeding mothers, it is simple, don't use. And someone is asking me, why that? Okay? Rewind and replay my entire presentation. Monitoring. Let's have complete blood count done with white blood cell differentials. Liver function tests will be helpful in patients with Cockayne syndrome. Why that? When we inadvertently administer metronidazole in anyone with Cockayne syndrome, then we'll stand the risk of running into severe hepatotoxicity or acute liver failure. So, if this is the diagnosis in this patient already, please let's have thorough liver function tests and liver enzymes done. The two are not the same. Liver function test is different from liver enzymes. Elderly patients must be closely monitored. Okay? And renal function tests must be done. Central nervous system examination for neurological complications. You can pause and rewind to adverse reactions, and I've explained that under central nervous system. And we must discontinue metronidazole if we are running into neuro symptoms immediately. Examples of where and when we can use metronidazole. Tetanus. Yeah. Remember, under the list of uses of metronidazole, I started with tetanus. It is important because metronidazole will alleviate the problem for patients already down with tetanus because they didn't take the normal vaccination and so on. Penicillin wasn't the situation for them. If this is the only thing you can take away from this presentation, please do. In tetanus, no penicillin, give metronidazole. Okay? The second thing you must take home is, while taking metronidazole, close those bottles, close those glasses, no alcohol. Okay, so now in tetanus and metronidazole, you can give 500 milligram metronidazole intravenously. Remember, this will contain sodium anyways, every 6 hours for 7 to 10 days. And trichomoniasis, can take metronidazole 500 milligram per hour twice daily for 7 days, or you may go for 2 grams once daily for 7 days. Another example is in Amebic Dysentery. You remember, metronidazole is antiprotozoal. Okay? So metronidazole 500 milligram or 750 milligram per hour every 8 hours for 7 to 10 days. Balantidiasis 750 milligram 3 times daily for 5 days. In bite wound, you can use metronidazole prophylactically. In that case, 500 milligram intravenously or per hour every 8 hours for 3 to 5 days. But if you are trying to treat bite wound, okay, it's the same dosage, the same route, the same rate every 8 hours, but for more days, about 14 days. In pediatric age group, you can give metronidazole intravenously between 22.5 to 40 milligram per kilogram per day, and then when you have your total, you divide into 3 or 4 doses. If you want to give it per hour, 15 to 50 milligram per kilogram per day, you have your total calculated through your calculator, then divide that into 3, given 1 day. For example, in perforated appendicitis, you can give metronidazole intravenously at 30 milligram per kilogram per day in 3 divided doses, or IV 30 milligram per kilogram per dose once daily with ceftriaxone. Because we are talking about perforated appendicitis. In that case, there will be peritonitis, septicemia, so many microbes in gastrointestinal tract, particularly the intestine. Then the anaerobes will be there. So you add your metronidazole with another broad spectrum, strong antibiotic like ceftriaxone. Infants can have intravenous or per oral at 7.5 milligram per kilogram per dose every 6 hours for 10 days. Now, the last bus stop when it comes to examples of where and when we can use metronidazole. Topical metronidazole, that on its own is large enough for a full separate presentation, but I will just summarize here that metronidazole could be in topical form like gel, cream, or lotion, useful to handle rosacea, or another name for that is adult acne. Okay, we use topical metronidazole also for acne vulgaris, and in that case we'll go for a very high strength at 2%. So that will bring me to the end of the presentation on metronidazole. Remember, this is a very good medication that can deal with protozoa. Amebic dysentery will be dealt with here. Amebic liver abscess will be dealt with here. Trichomoniasis will be dealt with here, and so on. And also, to deal with anaerobes, okay, where many antibacterial agents will not be able to work efficiently, metronidazole will do. And that is why we use it in so many cases of abscess. And also, when you have used clindamycin or other antibiotics, and the patient is done with Clostridium difficile associated diarrhea or Clostridioides difficile associated diarrhea or C. diff, you use metronidazole. Remember, when you are pushing the intravenous metronidazole, you are also administering sodium because it contains sodium. Thanks for listening. Remember to share this. Remember that you don't take alcohol when you are taking metronidazole, and you don't give it in first trimester of pregnancy. Remember to subscribe. Leave your comment. I appreciate it.